Hi, good afternoon. My name is Ivy Luzon das Cabrelius. I'm gonna show first my complete uniform with my white shoes here, and this is my ID with school ID. So my school ID number is 382292 382292. Now, next I'm gonna read the scenario. You are the practical nurse learner caring for Mrs. Shirley Smith. 10 days ago, she presented to the emergency department stating that she was experiencing severe upper right quadrant abdominal pain. She underwent an emergency open cholecystectomy and then was admitted to the gastrointestinal surgical unit. She developed an infection and therefore had a prolonged hospital stay. Today, she will be going home once she removed her staples. Then I'm gonna read the doctor's order. So I'm gonna show the back of the doctor's order to show that there's no written anything at the back. So I'm gonna read now the doctor's order. So Bubali College Hospital, 332 6th Avenue Southeast, Calgary. MRN number 125-2569. Room number is 352. Patient's name is Smith Shirley. Date of birth 1985 March 27. Gender is female. Physician is Sparks Gregory. Admitting diagnosis: severe upper right quadrant abdominal pain. Emergency open cholecystectomy. Medical history: C-sections at the year 2018 or cesarean sections. Allergies: no known to allergies. Her weight is 81 kg. Goal of care is designation is R1. Client is expected to benefit from and is accepting of any appropriate investigations, interventions that can be offered, including the options of ICU care and resuscitations. So the physician's orders today's date as October 6, 2020 at 11 a.m. Remove all staples, apply steri strips, and cover with sterile dressings and discharge home. Signed by Greg Sparks, MD. Then 10 days ago at 9 o'clock, it was September 26, 2020. The physician's order are Zibazolin 1 gram IM, every 8 hours, acetaminophen 500 mg POQ 4 hours, PRN maximum of 4 grams per 24 hours, Tylenol number 3 to 1 to 2 tablets Q 4 hours PO PRN, morphine 1-2 milligrams subcutaneous Q 1 hour PRN, on that citron 8 mg IM Q 4 hours PRN, insert polycatheter and attach to straight drainage if PBR more than 400 ml times 3, accurate intake and output, clear fluid diet, advanced as tolerated, CBC, electrolytes. Then the last one is cleanse abdominal incision with normal saline and apply sterile dressings every shift and PRNs. So I've done reading the doctor's order. I'm gonna wash my hands or sanitize my hands. Now I would gather all the materials needed for the procedures. So the procedure is staple removal, clean wound dressing, and then apply new dressing. So these are all my materials. First is the blue underpad. Then assuming this is a normal saline, so you have to read 3 times. You have to check 3 times. So normal saline 0.9 sodium chloride, normal saline point sodium chloride, normal saline point sodium chloride. 0.9% sodium chloride. Then for wound dressing, the expiry date is July 2021. It was opened yesterday, October 5, 2020 at 6 p.m. So today is October 6, so we can still use this one because this is good for 24 hours. Now after that is this next is my dressing tray, because assuming this is not open, so it's sterile, and then the expiration is 2022, year 2022. Next is my staple remover, assuming it's not yet open, so the expirations is July 10, 2023. Now next I have 2x2 sterile gauze and then 4x4 sterile gauze. I have steri strips. It's not yet open, so the 2022 is the expiration, so it's still good. Now I have a plaster. I have the sanitation, the hand sanitizer. I have a clean gloves. I have alcohols, hand sanitizing wipes, and to wipes my table later on. Then assuming this is my disposable or sharp container, Then this is my wristband of my patients. Then this is my patient's, assuming this is my pillow. So assuming this is my patient. So this is my left hand is the head of the patient, and then the right hand is the lower legs or of my patients. Now, so I've done gathering all my materials. So I'm gonna bring all my materials together with doctor's order to the patient's room. So I'm gonna knock the patient's room. So knock knock. Hi Shirley, good afternoon. My name is Ivy. I'm here to perform the staple removals of your wound. At the same time, I'm gonna change your dressings and then put a new one. So by the way, can you she said that she's okay, she's fine. Then hi Shirley, can you tell me your last name please? She said she's Smith. And then what is your date of birth? She said March 27, 1985. So you have to check the ID of together with the doctor's order. It says name is Miss Shirley, MRN 12525-69, room 352, gender female, and then date of birth 1985 March 27. Then the physician is Dr. Sparks Gregory. So I've done checking checking the identity, the verifications of the identity of the patients. So I've done. So I'm gonna put this one away. So now, so next of my procedure, so what I'm gonna do is to ask the patient if she's an allergy. Hi Shirley, do you have any allergy? She said no. Then is there any pain at the moment? Are you in pain? She said no. So if ever the patient is in pain, you have to give medications. As per doctor's order, give the medications 30 minutes prior to the procedures. So you have to ask the pain scale for the client. So 0 is no pain, 5 is moderate, and then 10 is severe pain. So after assessing the pain, so next is you have to remove the old dressings. So putting the old dressings, removing the old dressings. Okay, I'm gonna sanitize my hands and then put my clean gloves. So I'm putting my clean gloves. So my clean gloves is the large. So I'm small. Just assuming this is small gloves. Okay, now I'm gonna remove the old dressing. So from top to bottom or away from the visions line of the patients. So by the way, prior from that, I'm gonna mention, before I forget, so you have only to expose the dressing wound or the dressing area, the dressing part of the client. So you have to cover the client and her legs, and at the same time, and then at the top of the wound, because to provide privacy of the client. So now I'm gonna perform to remove the dressings. So like this. So remove slowly, slowly, slowly. Then, so I remove it already successfully. So there's no drainage. So assuming there's no drainage in my drainage the sterile the old dressing. Now, so since this is but you have to assess the wound. So REDA, R stands for redness, E is for edema, another E is for ecchymosis, D is for drainage. The A is approximation. So now since this one is dirty already, contaminated, so I'm gonna put this one into the garbage and then I'm gonna remove my gloves together with this dressing. So I'm gonna use my left hand, remove my gloves with my right hands. Then I'll put my finger under this one like that and then remove. So if you notice, I didn't touch anything. I'm not contaminated, and I'm gonna dispose. So now I'm gonna, since I removed already my gloves, I'm gonna do my washing hands or put a sanitations. Now, so I've done already assessing the wound. So I'll assuming that I measure the one approximately 1.5 centimeter. Now, so after that, so removing all the dressing. So I'm gonna clean the one. So before that, I'm gonna set up my sterile field. Now, so my sterile field is I'm gonna use my sanitary wipe. Sorry, oh my gosh, sorry. So this one I'm gonna clean up my table. Okay, so assume it's clean already. So I'm gonna wash my hands again. Okay, so I'm gonna by the way, this one, the underpads, I put it here under, and okay, and the legs of the patients. Okay, so next is I'm gonna pick up the tray dressing tray. So as I said earlier, is assuming it's a sterile, it's not yet open. So I'm gonna open this one towards me. So I'm gonna open like this. So this one, open, I like this one. Then I put under this one. I'll make it sure that I won't touch the above, so to prevent contamination, to avoid contaminated of the field of the tray. I mean, so I'll put it here. Then I'm gonna pick up the green forceps. So I'll just lift up a little bit so that the video can can be seen by the video. Okay, I'll pick up. So this one is. So now, since in my forceps, this one is contaminated already, the tip should be maintained sterility. So don't touch anything up always. So I'm gonna find I'm gonna pick up the drape, the first drape, and find the edge of the drape. So this one. Okay, here. Now, so I'll touch the edge, and then I'll make it sure that the shiny should be downward at the bottom, not the top. So this one is. Okay. So the quarter inch is or the sides or 1 inch is considered non-sterile. Okay. This so I'll make a window for this. Okay, I'll sit back. So now I have in the tray, I still have the second drip. So since I'm using the first drip, so the second drip, I can discard this one. Now, next is I have the garbage. So I can put this one away, the garbage. Next is I'll pick up the 4x4 gauze. So I'll step backward and then move a little bit forward. But I remember that there's a gap on the table on me. So to maintain the sterility, I have a window. I'll put it in the center. Okay. So next is I have to pick up the forceps. So the first forceps I pick up already together with the 4x4. So it should be separate. It should be the separate to pick up the 4x4 and then the forceps. But since I put it already and then I maintain the sterility, that's the important part. So maintain the sterility. So it's there already, the first forceps. Then now I'll pick up the second forceps. Okay, I'll put it this one like this. Okay, now I'm done with that. So I'll put my green pick up forceps, the green pick up forceps here, like this. So as remember that this one is unsterile, so I can put this one, and then the tip, it should be in the sterile area, like this. Now next is I'm gonna pour the normal saline to the sterile tray. Now, so 0.9 sodium chloride. So since this is open, I'm gonna open this one, and then that should be toward upward. So put it like this. So since, by the way, this one, I'll pour this one a little bit to the garbage. I have a garbage here, a little bit. Then the rest, then I'll put into the to the empty space here in the tray, dressing tray. Then making sure the tip is not touching to the tray, like this. Then I'll cover. Okay. Then I'll pick this one before I forget my garbage. So okay, come on. Okay, here. Sorry. Okay. Okay, so after putting this one, what's next mine is I'm gonna perform to clean the dressing. To clean the dressing. Sorry, it always fell, so I'm not using that one anymore. But anyway, so I'm gonna wash my hands. Okay, so now I'm gonna clean the wound. So I'm gonna pick up the forceps. So I'm gonna pick up the two forceps, the sterile forceps. This one, and then okay, this one. So I pick up successfully without touching the tip. Okay. So now I have in my two hands the forceps. So the tip is up. Now I'm gonna put the sterile goes 2x2 to the normal saline to soak it. Okay. Okay. I'm gonna now clean the wound. So starting from the top to going to the bottom. So downwards. So in a one stroke only. So start at the center of the wound, like this. Okay, discard. Next is you have to clean the far sides. Same directions. When up going to down, like this. Then discards. Then the last one is this one. Yeah, you have to clean the near beside you. So top to bottom, top downward in one stroke. So this one. Now I've done cleansing the wound. So let it dry or air dry, or you have to wipe with the sterile gauze, 2x2 or 4x4, whatever whatever you're comfortable. So I'm gonna put this one first. Here. So that one is I maintain the sterility. So after cleansing my wound, cleansing the wound, so I've done cleansing the wound. Now what I'm gonna do now is, so assuming it's dry already, the wound. Now, so next is I'm gonna put I'm gonna remove the staples now. So before that, I'm gonna wash my hands, and then put gloves, clean gloves again. Okay, this one here. Now, okay. So I'll pick up the sterile remover, staple remover, sterile remover, staple remover, sterile, whatever, staple remover. I mean. So assuming this is a clean, it's not yet open. I'm gonna clean open like a banana peel, like this. Okay, I'm gonna use the pick up green forceps. Here. I'll put it here because I'll put the staple the staples later on, and then I can use this one. I can touch this one, then and then dispose. Now, I will start now to remove the staples. So make it sure that the two tips is down. Down. So it's here. It's down already. So I'm gonna now. So I'm gonna remove only 3 staples, but the staples is 8. Is 8 staples. Assuming that I remove all the 8 staples, but I remove only 3 for the purpose of the demonstration or return demo. So I'll put okay, remove at the okay, put at the center of the ski, under the staple, then giggle slowly, then remove. Then here, and then I'll do the second one. Then giggle. This one. Next is okay, this one. Now, I've done removing the staples, so I will count this one. 1, 2, 3, and then I'll dispose to my sharp container. This is my sharp container. Now, so that I am done with that, so I can put this one here, just in case I will use that one later on. Now, I've done the removing all the staples. So what I'm gonna do is put the steri strips. So, because my gloves is large, I will assuming that I will remove this one because it's gonna be uncomfortable. It will stick to my gloves. So assuming that I'm wearing the small gloves, but I remove this one. I remove this one. But okay, assuming I have a small gloves in my hands, then I will open this one, and I like a peeled banana. Then remove. Then peel this one. Look here. So this one. So I will apply now the steri strips. So I will do the center first. So, sorry, it won't stick properly, but assuming it is stick already, then the next is the top one. Next is the bottom one. Okay, so I've done applying the sterile strips. Now, next is I will put new dressings, the sterile gauze. So I'll put gloves. So I have 4x4 in my sterile field, so I can use that one. So I'm gonna pick up this one, my green forceps. Then using my window, I'm gonna pick up here at the center. So this one. So I'll put the new dressings, sterile dressings of the wound, like that. Now, I'll put back this one. Because of my gloves again the staple is gonna be stick here, but I will try to show if it is not, maybe it won't stick right now. So now I'm gonna tape it. So like that. I'll make window to staple this one. So sorry, it's really stick. Okay. Sorry. It is stick. Alright. So assuming it's a stick already, I've done the dressing properly. So after that, I'm gonna write it. Since this is a sterile gloves, still already contaminated, so I'm gonna dispose this one. Okay, and then wash my hands again, and then write the date, then the time, and then the initials. So the time today, the date is October 6th, then 1 o'clock in the afternoon. So I had go initial. So now, after that, you have to provide patients health teachings. Instruct them not to touch, scratch the wound, to minimize to prevent infections. Give the instruct diet, good diet, health diet, rich in vitamin C. Rich in vitamin C to promote wound healing. Third is report any sign of infection such as pain, foul smelly odor, and then there's a drainage. So that's a sign for infections. Now next is I've done already. So lower the bed for the safety of the patients. Then the side rails for the safety of the patients. Then ensure the comfort that the patient is comfortably. Hi Cheryl, how are you after the procedure? She said that she's good. Now after that, so I'm gonna put again my gloves, clean gloves, then dispose all my materials that I used. So the sharp like this, the forceps put in the container, in the sharp container, and then all my biohazards, all my contaminated materials put in this one here, this one, and put in the biohazards materials, in the biohazard garbage. So that's it. So that's my procedure today for the removal of the staples. At the same time, the wound dressing, cleansing the wound, and then change dressing. So that's it. Before that, so before I say goodbye, I'll remove this one and my gloves, and then perform one hand washings. And that's all. Thank you very much. Have a nice day. Stay safe, everyone.